Grim reality about COVID-19 and the death toll it's taking on seniors. Deadly outbreaks are sweeping across Canada's nursing homes and long-term care facilities. Federal officials will provide an update today on measures for seniors. But in Dorval, Quebec, there are now 3 separate investigations into a privately owned long-term care facility where 31 residents have died. Montreal Police and the Quebec Coroner's Office are trying to determine exactly what unfolded at Résidence Herron. The 31 residents died in under a month, at least 5 from COVID-19. The cause for the others, not yet known. There are allegations residents were abandoned by staff, left to fend for themselves without food, water, or any basic care. Let's bring in Aaron Derfel on this, health reporter for the Montreal Gazette. He joins us now to talk some more. Aaron, thanks for your time today.
Good morning, Marilla.
Give me an idea of a timeline here. How is it we are only now learning about all of these deaths when there clearly were problems late March when the province took it over?
So the timeline is that on March 29th, they found out how bad it was. Workers from public health showed up at the Herron and, to their absolute horror, discovered that there were at least a couple of patients who were already dead in their beds, that there were patients on the floor, that there were patients who were so dehydrated, their mouths so dry they couldn't speak at first. This was such a shock, and that's when authorities placed the Herron under trusteeship. Now, prior to March 29th, we know that that this is a privately run facility. Workers there were saying that they weren't being given the personal protective equipment that they needed. Workers were scared, and I spoke to one worker who admitted, yes, we abandoned the facility. It's truly, truly tragic.
They abandoned the facility, meaning they left, they weren't going to come back, they thought the owner would bring in other people. I mean, how did they walk out and not think of what would happen to the residents?
Well, there were workers who were supposed to come in and they just didn't come in, and there might have been workers who left. So, you know, if you're going back in time, perhaps the Thursday or the Friday, they knew workers were getting infected. So those who were infected had to leave. There were other workers who were suspected of being infected, so they had to go home as a precautionary measure and in self-isolation. That left fewer workers. They weren't sending in reinforcements because this is a privately run facility. Some of the workers said that their pleas fell on deaf ears, pleas to both the provincial government, the health authority running that region, the West Island, as well as to the private owners. And so what happened is a cruel arithmetic took over, where the remaining workers who had to take care of more than 130 patients, some of them had to make this cruel choice. What do I do as a worker? Do I stay and risk getting infected and risk infecting my family when I return home? Or do I leave and leave and desert my post and abandon the residents there, the elderly residents who helped build this country? And unfortunately, some workers made that choice.
Aaron, I'm sorry, I've got to leave the conversation there. We've got something we've got to move over to in Ottawa, but thanks